things go, and you're always in disguise, my hero. I see your light in the dark, smile on my face when we all know it's hard. There's no way to ever pay you back. Bless your heart, know I love you for that. Honest and selfless, I don't know if this helps it, but good job.
My name is Dr. Todd Porter, and I am a community pediatrician and parent of 3 elementary-age children, 2 of whom have dyslexia. Not only have I had to witness the emotional trauma and educational loss from the loss of in-person learning in my own children, but on a daily basis have to witness it over and over again in my low-income patients. Loss of in-person school in my patients is resulting in failing grades, virtual dropouts, depression from isolation, and skyrocketing rates of obesity. Initially, schools were closed at the start of the pandemic due to concerns that children would be super spreaders of COVID-19, like influenza, and drive the pandemic. Quickly, however, it became scientific fact that unlike influenza, children rarely are the index case in the household, and due to innate cross-immunity, are more likely to be asymptomatic or have mild symptoms. Research has shown that children are also less likely to be asymptomatic carriers of the virus. Numerous contact tracing studies in educational settings have confirmed that positive students and staff rarely transmit the virus within schools, and it is well accepted even by the director of the CDC that students and staff more often become infected in family gatherings, meaning that school positive rates reflect community-acquired infection. The fact is supported by school positivity rates being orders of magnitude lower than community rates over the same time period. It is vital to know that COVID-19 is not equally dangerous to everyone. There is a 1,000-fold difference in mortality between those over the age of 70 and children. In fact, 40 to 50% of those infected do not even have symptoms. So what about the safety of teachers? Jeffco Public Schools has data that has shown a similar positivity rate between teachers teaching in person versus remote only, suggesting schools are not vectors. The average age of teachers in the US is 42 years, with 80% being under the age of 55. Unlike healthcare workers, where I work, teachers work with a low-risk population that is much less likely to acquire or spread the virus. With current infection control strategies at school, teachers are much safer at school than they are at home. Data from Sweden, who never closed schools, did not show any increase in fatality rates in teachers compared to other professionals who worked from home. There's no scientific evidence that supports students and teachers not being in school. We must demand that the governor open up schools and remove the crippling quarantine rules on asymptomatic exposed students and staff. It's time to prioritize children over the personal fears of adults.
Hello, my name is Cindy Myers, and I am an RN with a background in critical care, public health, and infection prevention. I want all kids to have the choice for in-person learning because the benefit of keeping schools open far outweighs the risks. School closures have resulted in widespread education inequality, disruption to healthcare, social, and child protective services. We know that when CDC guidance is followed, in-person learning can be accomplished in a safe and effective way. With the added protection of a KN95 mask, teachers are protected from 95% of both droplet and airborne COVID particles. This is higher level PPE than we wear with patients in the hospital setting. All of the evidence to date shows that schools can and do operate safely in person. The longer that schools remain closed, the more life-altering impacts we will see for these children. Let's work together to change that and get our schools back open.
I'm Dr. Michelle Wolcott. I'm an orthopedic surgeon and a parent of kids in the DPS school system. We see patients every day. We're essential employees, and we see 20 to 30 people in a small space like this room. We wash our hands, we wear our masks, and we follow the recommendations by the CDC to keep ourselves safe and to keep our patients safe. Teachers are essential workers too, and our kids having education in person is an essential service. There is no reason and no data to suggest that we cannot do the same for our kids in our classrooms that we are doing for our patients in our clinics.
Hi, my name is Emily Piala. I'm an internal medicine PA. During this pandemic, not only am I treating my normal patients that aren't the most healthy, we also have a ward open and I'm treating and diagnosing COVID and testing. I have 3 small children that currently are not in school due to COVID. My husband is a firefighter, paramedic, and I believe the safest place for children is really in school. They've done a great job instituting safety measures to protect children and teachers alike. School is the best place for their mental health, their physical health, and for their well-being.
I'm Tara Kalupa, and I'm a respiratory therapist that has been on the front lines continuing to save lives of people who have been fighting with COVID-19. I'm continuing to stay safe by wearing my mask and washing my hands often. There has been no proven data to confirm that in-person learning in schools is contributing to this pandemic. And I feel as though students and teachers can stay safe by washing their hands and wearing their masks. I strongly feel that we are doing far more mental, social, and emotional damage by keeping these kids at home than to send them to school. So please consider in-person learning for January.
I'm Sumit Garg, an orthopedic and spine surgeon. I strongly support in-person learning for all children in Colorado. Over the past 9 months, we have learned the emotional, educational, and social impact to children who have been kept away from schools. It is time to get them back. With the health precautions in place, it is very safe to return to school, as the experience in private schools, as well as other public schools around the country and around the world have shown.
Hello, my name is Erica Shook. I'm an ICU nurse and I support in-person learning 100%. Dr. Fauci has recently said that he believes all kids should be in schools and they are not the super spreaders. It has also recently been published in a JAMA pediatric journal that kids' lives can be shortened by 5.53 million years because due to lower graduation rates, which will lead to people being less educated, which will lead to higher rates in smoking, drinking, and as a result, cardiac health disease. So we owe this to our kids that they return to school 100%. Thanks.
Hi, my name is Taylor Winters, and I'm a physician assistant whose past 10 years has been spent in emergency medicine and acute care. Children are minimal vectors for the disease and have a very, very, very low side effect profile, minimal risk for hospitalization. There is a greater risk to children of the flu. However, what is of great significance is the other downstream effects from the lockdowns, including abuse, anxiety, depression, suicide, substance abuse, and losing a year of education. It's absolutely detrimental to our children. Do the right thing and get our kids back in school.
Hello, my name is Maggie Hawkins. I'm a pediatric physician assistant at Parkview Pediatrics in Littleton, Colorado. I feel this is critically important for our kids for a multitude of reasons. Mentally, as a pediatric provider, I can tell you our kids are struggling. We're seeing increases in rates of anxiety and depression, and our kids are overwhelmed and they're exhausted. Socially, we're seeing so much isolation. Our teenagers are struggling, and our kids are having impacts at home from loss of wages for family members, increased stress and anxiety in those fashions. Our parents need to be able to get back to work, and in order to do that, we need to get the kids back to school. Physically, we've seen kids have major increases in weight gain just due to inactivity, the fact that their sports and activities, school-based programs are all closed. And then lastly, kids are struggling academically, and I think this one is so critical. Our kids are having Zoom fatigue. We're seeing so much focus and inattention problems. Kids are struggling to maintain concentration when they're on school for 6 to 8 hours online. We're seeing kiddos that have never failed before struggling to maintain their grades. I worry about the high school kids not being able to keep grades that are good enough to help them in their college searches and things like that. So please consider what is happening to our kids physically, mentally, socially, and academically, and please try to get them back to school as soon as possible. Thanks so much.
Hello, my name is Vanessa Hoy. I am a pediatric nurse practitioner. I am here to advocate for in-person learning. The CDPHE data suggests that with the multiple mitigation measures put in place, that schools are a reasonably safe place for both students and for staff. I urge JEFCO leadership to think of the multiple trade-offs that happen with the intervention of school closures and work together as a community to get our schools open as soon as possible. Thank you.
Hi, my name is Adrienne Zuber. I'm a medical professional in the pediatric community. There are ways that we can get our students back into the classrooms with safety protocols in place while continuing their education and giving them the social interaction that they need. I know that there are a lot of students right now that are struggling with increased anxiety and depression because of the lack of consistency and the lack of interaction with their peers. I hope that we can continue to move forward with getting our kids back in person full time so that they can continue learning and they can continue thriving with socializing and engaging with their peers and teachers. Thank you.
I know when it feels like the end of the road, you don't let go, you just press forward. You're the engine that makes all things go. Always in disguise, my hero. I see a light in the dark, smile in my face when we all know it's hard.